90% of individuals are demolishing their own liver each and every morning, and they are accomplishing it with something they have been assured is beneficial. Meanwhile, your liver at this very moment could be transmitting emergency signals, and you would have absolutely zero awareness because it never aches until it is nearly too late. You assume cirrhosis, that is the complete scarring and shutdown of the liver, exclusively occurs in alcoholics? Throughout 15 years of medical practice, I have sat opposite patients with catastrophic liver deterioration who had never touched a single drop of alcohol in their entire lives. They consumed freshly squeezed juice each morning and referred to it as a cleanse. The establishment will not disclose what you are about to hear. There is no financial gain in a patient who genuinely recovers. The alarm sounds at 7 o'clock in the morning. You were in bed by 11 o'clock, yet you open your eyes and feel as though you spent the entire night shoveling concrete. Climbing out of bed feels like a genuine physical struggle. You drag yourself to the bathroom, and there is this sensation in your mouth, metallic, bitter, entirely wrong. You brush your teeth, glance in the mirror, and the individual staring back at you has dull, grayish skin and bags beneath their eyes that were not present a few years prior. So you head to the kitchen and pour the first cup of coffee. By 3 o'clock in the afternoon, you collapse, that recognizable, suffocating exhaustion. Your mind is still attempting to operate while your body flatly declines. And what do we tell ourselves in that moment? We attribute it to poor weather, atmospheric pressure, or simply aging. That twinge beneath your right ribs after a substantial dinner, you swallow a digestive enzyme tablet and forget about it by morning. We have normalized these signals to such a degree that we have completely ceased recognizing them. Here is what I need you to comprehend today. You are not fatigued. You are intoxicated. Your liver did not complete its work overnight. Toxic metabolic waste is circulating freely throughout your bloodstream right now and poisoning your brain cells. That fog enveloping your mind, that desperate craving for coffee just to function, that is not a caffeine deficiency. That is chemical overload. The bitter sensation in your mouth, that is bile backing up into your stomach and esophagus, a mechanical failure triggered by a chronically overwhelmed liver. And that evening skin irritation, the one you attribute to laundry detergent or dry winter air, those are toxic bile acids your liver was unable to process. They escaped into your bloodstream, traveled to your skin, and are chemically burning your nerve endings from within. Allow me to share the most significant anatomical reality you will ever encounter regarding this organ. Your liver contains absolutely no pain receptors within its own tissue, none whatsoever. A surgeon can make an incision into it, and the liver itself experiences nothing. Evolution designed your liver to be completely silent. Your heart alerts you with crushing chest discomfort. Your stomach screams with cramping. A troubled tooth will deprive you of sleep all night. Your liver will labor itself to death in absolute silence. I hear an identical statement from patients constantly. "Doctor, my liver does not hurt, therefore it must be fine." That reasoning will be your undoing. That silence is the snare. So what actually generates that sensation beneath your right ribs? It is not the liver itself. First, it is the gallbladder. When your dietary habits are poor, bile transforms into something thick and viscous resembling motor oil. Stress causes the bile ducts to seize up, producing sharp shooting discomfort. That is the gallbladder signaling distress, not the liver. Second, the liver possesses a protective outer membrane called Glisson's capsule, a snug sleeve wrapped around the entire organ packed with nerve endings. It only produces pain when the liver swells sufficiently to push against it from within. That is precisely what occurs during hepatic steatosis, fatty liver disease. You experience that as a heavy, constant pressure resembling someone having placed a cold brick beneath your right ribs. By the moment you actually perceive that brick, the deterioration has been advancing for years, occasionally decades. I have treated patients with end-stage cirrhosis who experienced absolutely nothing until the day their skin turned bright yellow and their abdomen began accumulating liters of fluid, what we call ascites. By that point, the opportunity for reversible intervention had closed. The genuine adversaries of your liver in the modern world are not liquor store shelves. They are concealed fructose, refined carbohydrates, handfuls of over-the-counter medications consumed at the initial sign of a headache, and persistent daily stress. I am encountering evidence of fatty liver disease in children as young as 10 or 12 years of age. That represents a quiet medical catastrophe not receiving nearly adequate attention. Allow me to illustrate the 4 functional stages of liver deterioration, because the majority of you watching right now are positioned somewhere between stage 1 and stage 2 without any awareness of it. Stage 1, the sluggish liver. In gastroenterology, this is designated cholestasis or bile stagnation. Envision a broad, fast-moving highway where traffic flows smoothly. That represents a healthy liver. Now picture a miles-long traffic standstill. The liver tissue itself remains intact at this stage, however, the bile thickens into a sluggish syrup rather than flowing freely like water. You experience this as nausea following fatty foods, persistent constipation, or oily stools that do not flush cleanly. The sluggish liver is the groundwork upon which every serious diagnosis that follows gets constructed, and an ultrasound at this stage will likely return completely unremarkable results. Stage 2, the fatty liver or hepatic steatosis. Continue disregarding stage 1 and the liver begins packing excess calories as dense fat droplets directly inside its own functioning cells. Picture a kitchen sponge submerged in thick vegetable oil. It transforms into something heavy and greasy with every pore sealed shut. That is precisely what occurs with your liver. Here is the critical fact you need to absorb. Are you aware of how foie gras is produced? Farmers force-feed geese not with fat, but with massive quantities of grain, pure carbohydrates. Fatty liver disease in humans follows exactly identical biochemistry. It originates from sweet rolls, instant oatmeal, and sugary beverages, not from a steak. You will still feel absolutely nothing at this stage. Stage 3, the inflamed liver, steatohepatitis. When sufficient fat accumulates inside liver cells, it begins to oxidize, literally turning rancid within your body. That toxic process triggers a massive inflammatory immune response. Your own immune system begins destroying your own liver. Functioning liver cells perish by the thousands, and only at this stage will you finally observe changes in your blood work, specifically an elevation in liver enzymes ALT and AST. When a cell ruptures, they escape into the bloodstream. That elevation is no longer a whisper, it is a siren. Stage 4, the scarred liver, fibrosis advancing to cirrhosis. Every time a liver cell perishes, the body fills that void with scar tissue, rigid and inelastic with absolutely no function. The scarring distorts the liver's architecture. Blood flow becomes mechanically obstructed and is forced to seek alternate pathways, upward through veins in the esophagus, creating life-threatening variceal bleeding, and downward into the hemorrhoidal veins. Once this stage is reached, complete reversal is essentially no longer possible. This represents the point of no return. Now allow me to provide you with a practical method to assess your own body right now, because your skin represents the most accurate external reflection of your liver's internal condition. First warning signal: small ruby red dots on your abdomen, chest, or shoulders. Dermatologists designate them spider angiomas. Your liver is responsible for eliminating used hormones, primarily estrogen. When the liver is overwhelmed, estrogen concentrations rise, small blood vessels pathologically dilate, and you develop these characteristic lesions. If you are observing more of them accumulating over time, your liver's hormonal detox capacity is deteriorating. Second warning signal: liver palms. Examine the fleshy mounds at the base of your thumb and beneath your little finger. If these regions appear unnaturally red or blotchy while the center of your palm remains pale, that is palmar erythema, a classic indication of impaired liver filtration. Third warning signal: chronically dry, deeply cracked heels that no moisturizer addresses. This indicates a deficiency in fat-soluble vitamins, specifically vitamin A and vitamin E, caused by absent bile flow. Bile is essential for absorbing dietary fats in the intestine. You can invest hundreds of dollars in premium supplements, but if your bile is not flowing, those vitamins will accomplish absolutely nothing. The cracked heels represent a textbook indication of stage 1 bile stagnation. Fourth warning signal, spider veins on your face across the nose and cheeks. Apply pressure with your finger, it vanishes. Release the pressure, it immediately refills. Another characteristic sign of elevated uncleared estrogen and inadequate blood filtration. Fifth warning signal, intense skin irritation at night, particularly the back, forearms, and shins, with no visible rash and no apparent explanation. This represents toxic bile acids circulating in your blood. The liver failed to deposit them into the intestines, they were reabsorbed into the bloodstream, and they are chemically aggravating your nerve endings. This is not a dermatological concern. This is not an allergic reaction. This is an indication that your blood has become toxic to your own tissue. If you are recognizing 2 or more of these 5 warning signals right now, do not go purchase a cortisone cream. That merely conceals the symptom while the internal deterioration continues unabated. I want to share a genuine patient account. I had a 45-year-old patient we will refer to as Victor, accomplished businessman, lean, physically active, not a single red dot anywhere visible. His heels were in perfect condition. His palms displayed a healthy coloration. He presented for a routine examination, genuinely convinced he was in peak physical condition. We conducted a comprehensive biochemical panel and an elastography, a specialized ultrasound that measures liver stiffness and scarring. Victor's liver was functioning at approximately 30% of its baseline capacity. Active fibrosis was already developing within the tissue. We examined his daily routine and identified the cause. Each morning, Victor performed a ritual he was deeply proud of. 3 large oranges, 2 green apples, a banana, occasionally a pear or cluster of grapes, all processed through a premium juicer, producing nearly 14 fluid ounces of concentrated juice. He consumed it on an empty stomach each morning, without exception, for an entire year. Why was this causing such destruction? Your liver operates as a 2-phase detoxification factory. Phase 1 enzymes, specifically from the cytochrome P450 family, identify incoming toxins and begin dismantling them through oxidation. Here is the brutal paradox. The breakdown products of Phase 1 are frequently 10 to 100 times more toxic than the original substance, becoming aggressive free radicals that destroy everything they contact. Phase 2 must immediately capture those volatile fragments and bind them to a safe neutralizing compound, usually an amino acid or sulfur molecule. The package gets sealed and dispatched through bile into the intestines or through the kidneys into urine. The entire system functions only when both phases maintain balance. Fructose, the particular sugar present in fruit, is processed exclusively by the liver. Glucose from bread or rice can be utilized by every cell throughout your body, but fructose has only one destination, the liver. 1 complete apple is acceptable because the fiber acts as a physical gate, releasing fructose in slow, small quantities. 1 large glass of fresh juice with no fiber represents a concentrated flood. Your liver receives the equivalent of 100 passengers, all attempting to pass through 1 customs entrance simultaneously. It converts the surplus fructose not into energy, but into visceral fat packed directly into liver cells through a process called de novo lipogenesis, generating fat at a rate 10 times faster than starch. Victor had also eliminated meat from his diet, convinced by an internet misconception that protein deteriorates in the intestine. Without dietary protein, his Phase 2 packaging crew had no raw materials. He believed he was conducting a cleanse. He had actually constructed a chemical waste site within himself. Your body provides readable signals about this every day. Examine your fingernails right now. Do you observe vertical ridges extending from the cuticle to the tip? Are the white half-moon shapes absent on most fingers except the thumbs? Now answer this honestly. How do you feel when you enter a perfume establishment or pass by a freshly painted surface? If your answer is immediate headache, nausea, or desperate need for fresh air, that represents a clinical warning signal. Your sensitivity to chemical odors is one of the most dependable indicators that your liver's detoxification system is at or approaching capacity. Here are 2 physical assessments you can conduct right now. First, wrap a measuring tape around your waist at the level of your navel without contracting your abdomen. For men, the critical threshold is 94 centimeters, approximately 37 inches. For women, it is 80 centimeters, approximately 31.5 inches. Above those measurements, you possess visceral fat stored deep within the abdominal cavity, draining directly into the liver via the portal vein. Your liver is immersed in a continuous stream of fatty acids 24 hours daily. The figure on the scale is meaningless. The circumference of your waist is everything. Second, locate your navel. Move your fingers directly upward 3 to 4 finger widths, then shift 2 centimeters to the right. You are now positioned over the sphincter of Oddi, the muscular valve regulating bile's exit into the intestine. Exhale completely and apply firm pressure. In a healthy individual, you experience nothing. If you experience sharp discomfort, pressure, or mild nausea, your sphincter is in chronic spasm. That valve is locked shut and bile pressure is accumulating in the ducts. Step to the mirror and gently pull down your lower eyelid. If the whites of your eyes appear cloudy or yellowish, bilirubin is not being eliminated and your filtration system is obstructed. Now allow me to address 3 concealed culprits that most overworked general practitioners in a 12-minute appointment will never raise. The first culprit is sitting in your medicine cabinet right now, acetaminophen or any cold and flu preparation containing it. You consume it for a mild headache or low-grade fever. What you are doing is eliminating your liver's primary antioxidant defense, glutathione, the liver's protective shield. A standard dose can deplete nearly all available cellular glutathione within hours. Acetaminophen overdose, including cumulative low-dose overuse, represents the leading cause of acute liver failure in hospitals across America and Europe. A harmless white tablet from the dollar store is inflicting more damage than a weekend of drinking. The second culprit is the black mold in the grout between your bathroom tiles. Those spots are aspergillus, a fungus producing mycotoxins directly harmful to liver tissue. Add the chlorine bleach you use for cleaning and the phthalate-based air fresheners you spray throughout the house. Your liver is filtering not merely your food, but the chemical mixture you inhale every single day. The third culprit is your stress response. The sphincter of Oddi is directly regulated by your autonomic nervous system. When you spend years in chronic stress mode, deadline after deadline, financial pressure, relentless news consumption, your body becomes locked in fight or flight. Digestion shuts down. Every muscular sphincter contracts. Bile cannot exit. It stagnates, thickens, crystallizes into sludge, and eventually into gallstones. Persistent stress physically seizes your bile ducts. Here is the encouraging news. Your liver is the only organ in your body possessing genuine regenerative capacity. Provided the right conditions, it can reconstruct itself from a fraction of healthy remaining tissue. The opportunity for reversal is substantial, but it diminishes as you delay. There exists one food, affordable and widely accessible at any grocery establishment, that represents the single most powerful, clinically validated activator of Phase 2 detoxification. 90% of individuals either avoid it or prepare it in a manner that completely eliminates its medicinal value in under a minute. That food is broccoli, specifically the cruciferous vegetable family. Inside the cells of raw broccoli resides a compound called glucoraphanin. When you chew raw broccoli, mechanically rupturing the cell walls, glucoraphanin contacts an enzyme called myrophanase. A molecular reaction produces sulforaphane, the most potent clinically documented natural activator of Phase 2 detoxification ever identified. Sulforaphane activates the genetic pathways that produce glutathione, that protective shield we discussed, and this protective effect persists for 72 hours from a single serving. No pharmaceutical preparation delivers that combination of magnitude and duration. However, myrosinase is completely destroyed by heat. Boiling broccoli kills the enzyme entirely. Here is the clinical protocol. Steam broccoli florets for precisely 3 to 4 minutes until still bright green and marginally firm. Then immediately apply a teaspoon of dry mustard powder. Dry mustard is extraordinarily rich in exogenous myrosinase. reintroducing the enzyme from an external source so the reaction occurs on your plate. For maximum effect, utilize 3 to 5-day-old broccoli sprouts, which contain 50 to 100 times the sulforaphane concentration of adult broccoli. Combine this with dandelion root tea or artichoke extract to gently stimulate gallbladder contraction and keep bile moving. But none of this produces results if you are violating your liver's circadian biology at night. The liver's peak detoxification activity occurs from 11 p.m. to 3 a.m. This transition only occurs when insulin and blood glucose are low. Consume fruit, pasta, or a cookie at 9 p.m. and insulin elevates, the liver pivots to fat storage, and the deep cleansing is canceled. Your therapeutic dinner should conclude 3 to 4 hours before sleep. Easily digestible protein, fish, eggs, poultry, steamed vegetables, broccoli with mustard, a tablespoon of olive oil, no starchy carbohydrates. The meal digests efficiently. Insulin returns to baseline, and by 11 p.m., your liver has complete clearance to commence its work. You will recognize it as functioning when you wake without puffiness, without that sour taste in your mouth, and genuinely feel rested. Regarding mornings, most individuals commit 3 critical errors. First critical error: cold water the moment you wake. Cold water triggers a reflex contraction of smooth muscle in your bile ducts. The sphincter of Oddi snaps shut, and backed up bile remains backed up. Second critical error: coffee on an empty stomach. Caffeine stimulates cortisol release, which seizes your bile ducts. Coffee also compels the gallbladder to contract, while the exit valve remains locked shut, creating pressure damage in your own ducts every single morning. Third critical error: eliminating fat at breakfast or fasting until noon. The gallbladder only discharges bile in response to dietary fat entering the small intestine. No fat means no signal. Bile sits stagnant for 16 hours, thickens, and begins forming crystals and sludge that become tomorrow's gallstones. Here is the practical protocol. Morning, first consume 1 to 2 large cups of warm water, approximately 120 to 130 degrees Fahrenheit. Warmth represents the most effective natural smooth muscle relaxant, opening the duct gently without pharmaceutical intervention. 30 minutes later, eat a fat-forward breakfast of eggs, avocado, and butter, the biological trigger for gallbladder contraction. Add high-quality sunflower lecithin to this meal as a natural emulsifier, maintaining bile fluid and free-flowing. Midday, eat 2, maximum 3 times per day. Real substantial meals, not continuous grazing. Every 40 to 45 minutes, rise from your desk and perform 10 slow squats to prevent mechanical venous stagnation in the pelvis, which directly compromises liver drainage. Lunch incorporates broccoli with mustard and a meaningful portion of animal protein. Evening, dinner at 7 p.m., consisting of light protein, cooked vegetables, and olive oil with no carbohydrates. Take magnesium glycinate or magnesium citrate before retiring to relax all smooth muscle sphincters overnight and support the deep cleansing period. There is one additional consideration most people entirely overlook. I identified it when a patient forwarded me a photograph of his sleeping position. He had been sleeping on his right side every night for years. Your liver weighs over 3 pounds. When you sleep on your right side, the complete gravitational weight of that organ presses down on the inferior vena cava, the major vein returning blood from your lower body to your heart. It compresses it, blood flow decelerates, and venous stagnation establishes itself throughout the liver. The identical problem occurs sleeping flat on your back. Condition yourself to fall asleep on your left side. The liver shifts left, the vena cava is decompressed, and blood filtration operates at full capacity throughout the night. A pillow between your knees is not optional comfort. It represents a physiological necessity for anyone over 40, aligning the pelvis, reducing intra-abdominal pressure, and allowing the liver to function without mechanical restriction. Here is what I want you to extract from this and genuinely apply. Your liver never produces pain until it is nearly exhausted, so do not wait for discomfort as your warning signal. Read the skin indicators I provided. Fructose from juice can damage your liver more rapidly than a moderate alcohol habit because it circumvents all cellular defenses. Acetaminophen is eliminating your primary liver defense with every casual dose. Steamed broccoli with dry mustard activates a 72-hour protective response that no supplement can replicate. Drink warm water first thing in the morning. Consume fat at breakfast. Complete dinner 3 to 4 hours before bed, and sleep on your left side with a pillow between your knees. Dedicate your body 3 consistent weeks of this approach, and you will perceive the difference. Clearer complexion, sharper cognition, and energy that does not collapse by mid-afternoon. Conduct the assessments I described today. If you identified 2 or more warning signals, do not delay. Schedule a liver panel, ALT, AST, GGT, total bilirubin, and ideally a liver ultrasound. If your physician dismisses it as normal for your age, persist. Ask specifically about your waist circumference, your triglycerides, and your fasting insulin. These are the measurements that actually reveal what is occurring internally. Your liver operates silently every second without ever requesting anything in return. It is the only organ that will continue performing its function at 15% capacity simply to sustain your life. It is time you devoted as much effort to it as it has devoted to you. Your physician is not going to guide you through any of this during a 12-minute appointment. The system is constructed around treating illness, not preventing it. There is no billing code for instructing you to steam your broccoli and sleep on your left side. I am Dr. Bennett, and I have devoted 15 years observing preventable deterioration occur to individuals who simply were not provided the correct information in time. This video is created for educational purposes only. The information shared here is not a substitute for professional medical advice, diagnosis, or treatment. Please do not make any health decisions based solely on this video. If you are experiencing any symptoms or health concerns, make sure to consult a qualified doctor nearby and go for regular checkups. Every individual is different, and only a licensed medical professional can provide the right guidance for your condition. Our goal is to raise awareness, but your health decisions should always be made with proper medical consultation. If you found this video helpful, don't forget to like, comment, and share. And please subscribe to the channel to help us reach 1,000 subscribers and continue bringing you more helpful and informative content. Your support truly means a lot. Thank you.